With the new year comes a new chief of staff at Community Memorial Healthcare. It's a big responsibility being the leader for physicians and patient quality. So today we'll meet Dr. Chris Johnson, also the director of the emergency department at Community Memorial Hospital in Ventura, and as of January 1st, the new chief of staff. We'll discuss what his position involves, the importance of primary care and post-COVID health management, and more. This is Wise and Well, presented by Community Memorial Healthcare. I'm Maggie McKay. Welcome and congratulations on your new title, Dr. Johnson.
Thank you, Maggie, and thank you for having me on today.
Absolutely. Just to start, can you tell us about yourself and your new role at Community Memorial Health?
So I started working at Community Memorial 21 years ago, directly out of my residency at LA County USC, and I've enjoyed taking care of patients in the community here for the past 2 decades and looking forward to my new role as Chief of Staff.
And what's your background in emergency medicine?
Well, like I said, I did my 4 years of training down at LA County, and that prepared me to pretty much take care of anything. And so directly out of that residency, I had a short stint at Cedars-Sinai, and I didn't like the commute and the hustle and bustle of Los Angeles. And my wife and I settled in this community of Ventura, which we love so much, and have enjoyed spending the last 2 decades here taking care of our patients.
Ventura is gorgeous. I used to work there too. It's beautiful. I can see why you would like to get away from the traffic. What does a chief of staff do day to day? Take us through your day. And what's your role in managing physicians and patient care?
Well, as you can imagine, with approximately 300 physicians in the Community Memorial Health System, there are always issues to deal with and small fires to put out. My main role is to lead the medical staff in making decisions and organizing our medical staff policies and enforcing our medical staff policies and making sure that we provide the best care to our patients. And that entails overseeing quality and the various directors of service lines in our hospital. And I'm pretty much sort of the liaison between our medical staff and administration. And so I interact daily with the administrative leaders in our hospital and with the medical staff at large, including the physicians in the community.
Dr. Johnson, what does a chief of staff do that impacts a patient's care and their experience?
Well, when patients come to our hospital, they expect a certain level of service. And if that level of service is not being met, then my job is to make sure that we make the changes to address our shortcomings and make sure that we make their experience better going forward. And so an example of that would be, let's say, for instance, in the emergency room where I'm most familiar with, if our wait times are too long or if the waiting room is too chaotic, then I could go down to the department, walk through it, and see how we can make changes and bring the leaders together to address ways in which to make the experience better.
And what are your biggest concerns with the state of healthcare today?
One of my biggest concerns is that post-COVID, there's a huge backlog of patients not being able to get in to see their physicians and procedures that have been postponed and delayed, and patients are really finding it difficult to get in to see their primary care physicians. So, to no fault of their own, they are utilizing urgent cares and emergency rooms for their primary care needs. And although we're able to provide great care in these facilities, it's not the same as seeing your primary care physician. So these systems are getting overwhelmed, and the patients aren't getting the care that they need. And we currently have a shortage of primary care physicians throughout the nation. And therefore, things like screening exams are being delayed. And my fear is that we're going to see complications of chronic diseases going forward for years now because of this backlog.
So in your new role, how will you and the physicians you work with and the other leaders at Community Memorial tackle these concerns to help patients access and receive quality care?
It's a great question and a very complicated one, but there are some concrete examples of things that we can do. For instance, the outpatient surgery center and our inpatient surgery center, we're currently very backed up with procedures that were delayed during COVID. And with the cooperation of our anesthesiologists and our surgeons, we will be able to increase our abilities to move through those cases more quickly. In addition to that, we have a robust residency program where we're training young and very talented new physicians. And our goal is to retain those physicians and encourage them to stay in our community and to become those primary care physicians and leaders in our community going forward. And we're really excited about this new energy that we have at our facility.
Let's talk about the importance of primary care in post-COVID health management. You talked about it a little bit, but especially from a chief of staff's point of view.
Well, the primary care physicians are really the core and the center of our healthcare system. They are the ones who orchestrate your care, and they make sure that you get all of your screening tests done, and they're able to keep you healthy. And that's one of the downfalls of the American health system is we tend to focus on treating diseases as they arise, whereas the primary care physician is more focused on preventing diseases before they actually happen, which is key to cost savings and key to keeping us healthy and having long, healthy lives.
When you look back at your career when you started, did you ever think you would be sitting in this position of chief of staff?
No, I did not think I'd be here. When you start out young and you move into a hospital, you look at these old sort of elderly, mature physicians, and it's hard to picture yourself being in that leadership role. Those doctors I admired so much and really looked up to. But as you go through your career, and I was involved in medical staff leadership from the beginning, and you learn so much and you gain all this institutional knowledge, and at some point you really feel like you want to mobilize that knowledge to help the system that you've put so much into. And thankfully that happened with me, and I'm honored to be in this position. I'm excited to move forward and make some positive changes.
That's very exciting. Dr. Johnson, it's been a pleasure meeting you and learning about the role of chief of staff and how it impacts patients, plus the importance of primary care and post-COVID health management. Thank you so much and enjoy your new chapter.
Thank you, Maggie, and thank you for having me on today.
Once again, that's Dr. Chris Johnson. If you'd like to find out more, please go to mycmh.org. That's mycmh.org. If you found this podcast helpful, please share it on your social channels and check out the full podcast library for topics of interest to you. This is Wise and Well, presented by Community Memorial Healthcare. Thanks for listening.